I'm Dr. Bob Kenovan from the Avalon Clinic.
Hello, I'm Teresa. I'm a clinic nurse here at the Avalon Clinic.
And today's topic is 60 days after surgery. And before we get into that, just want to follow up on what we talked about last time. And that is the video that's put out by BBC called Breast and Me. And I've been looking for it. I haven't seen it. Have you had a chance to see it?
I have not had a chance to see it yet.
I keep hearing it's very good, so I would really like to see it, and I would probably encourage you to see it. Anyway, back to the topic. So,
Today we're going to be talking about 60 days after surgery. Dr. Kenovan, tell me about the healing at 60 days.
okay. So, at 60 days, what's going on is that the blood vessels are starting to disappear that have grown into the scar, and they're starting to fade and go away. In addition, the swelling is decreasing, and at the same time, the scar is starting to change. It will continue to change for at least 12 months, and it's entering the final phase, if you would, of scar formation.
So the scar, tell me about the scar.
Okay. So the scar, we already said that the scar itself is still red, and that redness is starting to fade. Oftentimes at 60 days, the scar feels it feels hard, it's firm, almost like a rope, and that will start softening after 60 days. And it may be itchy. And the other thing that happens at 60 days is the sutures that are underneath start dissolving, and sometimes they will poke through the skin. So, Teresa, from a nursing standpoint, what do we tell them to still avoid at 60 days?
At 60 days, you should still be avoiding direct exposure to the sun on your incisions. I would say that's about
The main thing. Yeah. And what can they do?
Anything at this point, just returning back to their normal daily activity.
Can they horseback ride?
Yeah.
Okay, so they can do yoga?
Yeah.
Oh, okay, so basically they can return to normal.
Absolutely.
Okay. And what do we expect to be taking place at that time? What do you tell them to expect?
I just expect for the redness to be fading, swelling decreased. Things are getting back to normal.
Okay, good. So they're kind of on an automatic pilot type approach. They just need to live their life.
Absolutely.
Right. So one thing that we said that may come up at 60 days is where the sutures underneath may start dissolving, and they may actually come through.
Yes.
From a nursing standpoint, how do you treat that?
It's very easy. So you would just clean the area with diluted peroxide, so peroxide and water, and just use your tweezers.
Right. And sometimes when it does this and starts dissolving, it almost looks like a pimple, almost like it's infected.
Yeah.
So what would you like them to do at that point in time if that should happen?
Sure. If that were to happen, we just would recommend phoning our office, and oftentimes the doctor would want to take a look.
Right. Okay, good. So if you had one thing you would like to emphasize, what would that one thing be?
It would just be to the return to normal. Anything that you would do on a daily basis, you're okay to do.
And I think that's a pretty good discussion of the healing. Good, and thank you.
Thank you.